Okay, hi again, everyone. Welcome to this evening's program on building a school list. I'm Dr. Amanda Dye. I'm the executive director at Beyond Barnard, and I'm excited to talk to you about some important principles for preparing an application to health professions programs. Um, Today, my goals are to help you all understand some of the larger and smaller factors that might influence the decisions that you make in terms of building your school list. We're going to spend the majority of our time together talking through how I encourage folks to evaluate programs using some case studies of both private and public medical schools. We're looking at medical schools because of the high availability of data around those programs and because most of the folks who are participating in our application process are applying to medical programs. Um, we will also talk a little bit about some resources that I think can be helpful for you as you are beginning your search. We'll start out talking a little bit about some factors that I think are important to consider. First principles here above all, what I want you to take away from this discussion is that professional schools are more similar to one another, within the same type of profession than they are different. They're much more similar than colleges are, right? So colleges can offer many different kinds of undergraduate programs. You could, as a student who's applying to a college program, be looking for an undergraduate degree in social work or a liberal arts degree, an engineering degree. And so they're, very, very vastly different academic opportunities. Whereas if you're applying to medical school or dental school, those schools are much more similar within their group than colleges will be. And because of that, you as an applicant really have to consider very subtle differences between programs as you are evaluating them and their goodness of fit for your needs. It's also important to keep in mind that every single one of these schools is going to receive a lot more applications from very well qualified candidates than they can interview. This is one of the very challenging things that admissions committees deal with. They just have, so many good applicants and they do not have the time and space to interview all of them. So what you'll typically see is that the largest cut in the process is from applicant to interview. Many schools are going to interview maybe 5 to 10% of the people who have applied, and ultimately they're going to end up admitting a much higher percentage of those people who they've interviewed. So your goal is to get to the interview process with a good number of schools. And the way that I think you can do that is essentially by considering what every single school that you add to your list is going to value about your application. So today, what we're going to do is talk a little bit about how you can start to think about what each of these schools that you might consider adding to your list actually cares about and what kinds of information you might use to figure that out. So first things that I want folks to consider when they're, even before they start building a school list, things that you want to kind of set in your own mind are things that relate to your long-term goals. Now, to go to any medical school means you've got a good chance of becoming a physician, actually, very strong chance. But different medical schools may offer different opportunities depending on the type of practice that you're interested in. So whether you're interested in primary care or another kind of specialty, the setting for your practice. If you're someone who's interested in working in an urban setting, for example, you might be more interested in training in a similar setting. You want to think about whether your long-term career goals involve academic practice. So, would you see yourself being affiliated with a big academic medical center, maybe having teaching responsibilities in the future? Or are you someone who's more interested in maybe like a private practice exploration? You also want to think about how much you're interested in continuing with research as a professional student and whether the schools that you are interested in are offer opportunities for that. You want to think about, how well each program's institutional mission aligns with your goals, and a little bit about, kind of what their history is with residency matching in the case of medical programs in particular, so that you can have a sense of whether a particular school is likely to support your specific goals well. Things that you can think about with respect to curricula are, again, little details are different. The basics of what you will learn in a medical program or a dental program very necessarily have to be the same, right? This is very tightly regulated education. However, things like availability of electives, availability of longitudinal clinical experiences, how much of the curriculum is kind of small group or problem-based learning versus large lecture formats, whether you would have access to other kinds of educational opportunities, those are things that you can evaluate. You also want to think about, like, how does the teaching happen and what is likeliest to work for you based on your history as a student, right? If you're a person who really prefers the kind of like small group setting, you're not a big lecture person, you might want to look for programs that really emphasize that kind of training. Are you, looking for a relatively flexible program where like lectures aren't necessarily required, they're recorded and you can, get that information on your own time? Are you interested in dual degree programs or specialized educational programs that are offered by a smaller number of schools? uh, you know, Timing of your coursework relative to standardized exams. Obviously, information that you can find about student performance on board exams is really important. How the grading works at a particular program might influence your decision of, either whether to apply or ultimately whether to attend. Many programs have a pass-fail preclinical curriculum these days, and lots of students prefer that for a variety of reasons. Um, so, oop. Just as an example, I'm going to show you a couple of schema of medical school curricula. So this one is from Sidney Kimmel Medical College in Philadelphia, and what you can see is that this curriculum is more than a year, like more than about a year and a half of kind of didactic education, right? They've got their foundations coursework arranged kind of by various different systems. There are breaks built in. There are assessments after each kind of major part of the curriculum. There's time set aside for preparing for step one of the USMLE, and then there are some specific clerkships, and then moving in the third and fourth years, a lot of electives, a lot more flexibility in terms of the curriculum. You can contrast that with a curriculum like the one at Duke, where you can see the didactic curriculum is in essentially the space of a school year, slightly less than a calendar year, and so this is most of the time that you're going to be in the classroom is really in that first year, moving directly into your clinical rotations, with, again, vacations built in and things like that. And because of that shorter preclinical curriculum, there's some more space freed up. And so Duke is a school that has a required scholarly experience. You are built in minimally 9 months of time to work on some kind of a research project. In that year, you also have test prep and test taking time. And then again, in the fourth year, mostly clinical electives and completing a capstone project as you are applying for residencies. When you are thinking about, your interests, especially if you're looking for these kinds of programs that do offer protected time for research, think about your past research experiences, what you liked about them, what you would like to carry into your education, and consider every school's individual opportunities. What can you learn about how funding is made available? What are the school's policies for taking time off for research opportunities? So some schools might really, robustly support students taking a year between years 3 and 4 of medical school to conduct research, especially if they're preparing for very competitive residency applications. And some schools have specialized programs that allow some students to elect to do particular kinds of research. For those of you who are thinking about MD, PhD programs, obviously research is going to be a very central part of your school choice. So I wanted to speak to that here. I find that school choice for MD, PhD applications really shares a lot in common with PhD applications. And what I mean by that is that the central question is what is your research program and how well do the programs, do the medical schools that you're considering align with the work that you want to do? You should be thinking about how many faculty are working in or, adjacent to the kind of work that you want to do and how familiar you are with their work. The folks who you've been citing in your research might be people to think about, as potential supervisors if they are working in programs that have MD PhDs. You want to think about the size of MD PhD programs. Most of them are very small in absolute terms, but some of them are 1 to 2 students a year small, and some of them are 15 to 20 students a year small. And so thinking about, are there other students who are currently in the program who are doing work that's in conversation with the work you want to do? Will you have collaborators? Will you have people who are there to, kind of challenge you and make your work better? Think about also training resources. Obviously, are there multiple institutional affiliations that might make a lot of sense, based on the work that you want to do? Of course, considering funding structure, although I will say MSTP, Medical Scientist Training Program, that's a designation that indicates that federal funding is supporting that program in some sense. An MSTP is not necessarily objectively a better MD PhD training program. It's just an indication of where funding is coming from. You should also think about, how your programs that you're considering kind of fit together, MD, PhD specific aspects of the training with the MD curriculum. And of course, it's always a good idea to investigate average time to degree because it's a lot less predictable in the MD, PhD sense, given that PhD research can take a variable amount of time. Uh, I'm gonna not necessarily spend a ton of time on these next few slides, but other things that you want to think about are what are the spaces that you're going to have access to, right? Will you have, places where you can gather with other students? What's the library situation like? What kinds of electronic resources are available to students? Does the program provide particular kinds of technology? What are the clinical sites that you're going to have access to? Are those, very close in space to the main teaching hospital? Are there opportunities for away rotations either within or outside the US? And if you're looking at programs outside of, the small sort of set of very major cities, are you going to need a car? Which is a weird practical thing, but an important thing to think about as you transition from living in New York. You want to think about student services. What kinds of counseling options are there? What are the actual supports that you can access? I encourage everyone to think about academic advising, right? Like what does that look like? Personal or like mental health counseling options for students. You're going to manage a lot of stress during your time as a professional student, and you want to know that you have support for that. Financial counseling resources, incredibly important because managing educational debt is typically a part of the process of being educated as a healthcare professional. And so are there good resources for helping you understand the loans that you're taking out and how best to manage those in the long term? Will you have access to specialized advising as you think about applying for residency or as you think about applying for specific kinds of jobs following your training? And, mentors, who does advising, all of those kinds of things are important to consider. Thinking about student policies can also help you kind of draw out some distinctions between schools. So academic evaluations, things like grading policies, but also, can you find out any information about mechanisms that exist for students to provide feedback, either to, evaluate instructors or, to be part of particular kinds of committees at the college. Those are things that you may want to consider as, very fine-grained differences. Of course, you want to think about who the other students are, how many people are in the class, and who's coming to this school. Are you likely to find a community there that is going to be supportive for you? If you're a member of an underrepresented community, are there support services, student organizations, or visible presence of faculty who might be good mentors for you? You want to think about whether or not student involvement in community service is something that the school is talking about a lot, right? That's an indicator usually that they're looking for candidates who are coming with very strong service backgrounds. What are the options for being involved with like student government or other student organizations, and how are those things going to affect your development as a professional? And then, of course, I'm putting this sort of, I think, last, but location is obviously a huge thing for most people. I think most folks who apply to professional programs are prioritizing proximity to their support networks, and I think that that is absolutely fair to do. I very strongly encourage everyone to consider public programs in their state of residence, and I'll talk a little bit more about that later on in the presentation, just kind of like what do we mean by state of residence and how do you prove that in the application process? If you are coming from a state that does not have a public medical school, there are in some cases options to apply as kind of a regional applicant, or there are programs that have kind of agreements with states to help kind of supplement the education that state residents would typically receive if they had a public health profession school. Thinking about, again, your geographic preferences in the long term, your professional training, especially if you are, applying to medical school and the next step for you will be residency. The 4 years of medical school are not necessarily the most kind of like entrenched you're going to be in a community. I think that, if you were to train somewhere that you didn't end up wanting to live in the long term, probably just more important then to look for options to match into a residency somewhere that you want to put down roots. But you may be thinking about, just in general, looking to train in programs that are going to be at least similar to the kinds of communities that you want to serve. And of course, you want to think about like how many other students are there going to be? What's the total cohort size and the total number of students in the school? Are there additional like PhD programs or other clinical programs, PA, OT, other kinds of programs that are, going to be part of your educational community at particular schools? And then of course, costs, right? It's important to consider what the costs are. If you have a spouse or expect to have one by the time you start, or you have dependents, are those things that are considered in financial aid packages? Cost of living and housing availability via the school itself, or subsidies for housing. Again, availability of financial planning and budgeting, counseling, as well as debt management. So now that I've yelled all of like the million factors that you could possibly consider, I'm going to run through some case studies. Basically, I'm going to talk you through some of the like publicly available, completely not insider information that you can access about programs to help you understand how well any given school might align with your particular preferences. So, I am hoping to get to all of them, but we may, do a little skip here and there as necessary. But what I have here are 8 total case studies for private and for public institutions in different regions of the country. And my goal is to help you understand like how to use the information that's available to you, especially in MSAR for medical programs, as well as the information on schools' websites, to understand what's important to those schools and to begin to consider like how they might evaluate your application. So we're going to start with Columbia because, we're part of the Columbia multiverse. I will also say to start that all of this data is reflective of the 2024 entering class. We will have access to the 2025 entering class data in April. So, MSAR pages will update in April. You shouldn't expect massive differences from this data because for the most part, medical schools aren't like wildly changing their admissions processes from year to year. So I'm gonna, you can obviously read any of this. I'm gonna point out things that I think are like particularly important about this school. So you can see, the over 7,000 applicants and over 700 interviews. They're interviewing about 10% of their applicants. So like I said before, big drop in terms of applicant to interview, ultimately matriculating 138 students. And Columbia does not have an early decision program, so those are all people who are applying through the regular process. Columbia does have a relatively large MD PhD program, so they matriculated 15 folks into the MD PhD in 2024. It's a school that has definitely interviewed international students, but there aren't any that are part of the class beginning in 2024. And you can see that there is a debt-free policy, but there are caveats to all of these sort of very broad policies at medical schools. So there is some graduate indebtedness, which may relate to like living expenses more than tuition itself. And what I can tell you though is that number is low relative to average graduate indebtedness for medical students. In terms of understanding metrics that are typical for the program, what I have down at the bottom is a little chart that includes all of the information that MSAR shares about metrics. So GPA, science GPA, and MCAT scores, so that you can see kind of in the middle, the median, and then the 10th, 25th, 75th, and 90th percentile. I share this information because I think that, while the medians can be informative, right? Medians for this particular program are quite high. Yes, all right, that's important to know. It's also incredibly important to look at the level of variation. And what you can see when you look at this is that there's not a ton. Right? In terms of the grades, there's a little bit of breadth there, but generally speaking, most people who are, in that 25th to 75th percentile, which is where most of the interviews are going to come from, we're talking very strong grades. And with respect to MCAT, we're talking very little variability. So those of you who have taken the MCAT and have received your score, you know that the score is reported with a confidence interval, which is kind of 2 points on either side of your official score. And that confidence interval indicates like on any given day, your score is probably going to be in this 5 point range somewhere. What you can see here is that the median is kind of surrounded by essentially the confidence interval, right? There's very little variation in terms of that particular factor for this specific program. Now, to think about not metrics, not kind of like numerical data, other things that you can learn if you take a look at Columbia's websites, for example. Number one, this is a program that really does emphasize research. They require a scholarly project for MD students. So research is not restricted to those who are in combined programs. They offer a very specialized healthcare management and rural health program that brings in a small number of students a year. So even though this is an urban program, it has resources that are available for students who are interested in rural health. As a, kind of a school within the broader Columbia universe, which has many, many, many professional degrees, Columbia offers a very large number, 6 different dual degree programs. So it's possible to pursue combined degrees with a lot of different fields. And, Columbia is able to take advantage of that because they're located in such close proximity to all of the other programs. Other things that are, I think, significant about Columbia is, of course, it's a gigantic international renowned medical center, but it's also the local hospital for my neighborhood for many years, Washington Heights. I was there this morning actually for a doctor's visit, and so there's a really kind of fantastic combination of patients, right? The folks who live here in the neighborhood, largely working class, many are Spanish speakers, and then people who are traveling from all around the world to come and access care. I think it's also significant to take a look at what the school says about itself, right? There's mention of students preparing to become leaders, right? They're looking for people who are interested in high level and leadership roles within the healthcare space. They talk about the convergence of science, research, and technology, as well as compassion, listening, desire to reduce suffering and promote health. So they're seeing, themselves as a place that are, on the cutting edge of knowledge production and really valuing humanism within that process. Okay, next program we're going to take a look at is a big contrast. So this is Tulane School of Medicine in New Orleans. First thing you can see right off the bat is that they have almost twice the number of applications that Columbia did. More than 13,000. This is probably one of the like highest application numbers of any medical program in the US. And they do even fewer interviews than Columbia does, only 585, meaning they're interviewing 4.4% of applicants as of 2024. That is really interesting to know, right? There is a lot of variability in their applicant pool, and they're clearly looking for something very specific in deciding about these interviews because they're interviewing a small number. So the question then becomes, okay, what is that, right? They do have a lot of spots via like early decision and early assurance programs. They're not a huge magnet for MD PhD matriculants. There were two. They are a program that is very, very open to international students. They interviewed 27 and ultimately matriculated 14, which I know is in absolute terms not a big number, but in terms of international students attending medical school in the US is a pretty gigantic number. Um, and if you look at the metrics information in the chart at the bottom, you get an even more robust picture, right? There is even more breadth in terms of the GPA and MCAT score range. It's clear that like they're being really selective about who they interview, but they're not defining that selectiveness based solely on the metrics. And that's a really important thing for folks to understand. Another thing that I would point out here is that the average grad indebtedness is very high for this program. So yes, almost three-quarters of students receive aid of some kind, but this is high level of debt relative to other medical programs. So when we're thinking about, okay, what could they be looking for? We know that it's not only grades and MCAT scores. Um, I look to things like the mission statement. So, improve human health and foster healthy communities through discovery and translation of the best science. I think that the presence of community in the first sentence of the mission statement is really significant. And I think that because there's a lot of additional evidence to support it. Tulane has, for a very long time, run a number of student-led clinics across the Deep South. They are a school that has a very, very, very well-known and well-connected public health program, and the medical school itself has a very strong commitment to public health. And so often, likely, they're going to be looking for candidates who share that ethos, that perspective. It's the second oldest medical school in the Deep South and probably the one with the broadest reach. They offer clinical training and obviously clinical care sites throughout Louisiana and the entire Gulf Coast region. And even though, again, this is a school that is primarily located in an urban setting in a city, they do have a specialized rural medical education program, which reflects their commitment to the broader region. Next up, I want to talk about Washington University in St. Louis School of Medicine. This is yet another pattern, something different from both of the previous two schools that we've seen. So here again, we have a sort of more moderate number of applicants, over 5,000, and they're actually doing a lot of interviews. They're interviewing almost 20% of their applicants. However, they're only matriculating a class of 124 people. WashU doesn't do any kind of early decision. They do have a very robust MD PhD program, and they matriculated 19 people into that program in 2024. They do interview a lot of international students, and I think the high interview number is a real proxy for how open they are to considering international applicants. And significantly, the average grad indebtedness is very low. So many of you may know that there are some medical programs that have very highly publicized, like debt-free or tuition-free programs. A lot of times, those programs do still come with some kind of a cost. And what you can see here is, and I'll spoil the rest of it for you, this is the lowest graduate indebtedness that I'm going to report today. A vast majority of students are receiving aid, and this is an institutional priority, right? Like this is something that WashU, even though they don't have necessarily a blanket policy for tuition free, they are still working very hard to help their students manage debt. Other things to note is, this is another school kind of like Columbia where there's not a ton of variation in terms of the metrics. So when we're thinking about choices that the school is making, even though they're interviewing a pretty large percentage of their applicants, in reality, it's likeliest that those interview offers are going to come for folks who are meeting the relatively narrow set of metrics that are common for the school. Keywords that I identify when I look at WashU's website, innovative, leaders. They're another school really, really focused on leadership, diversity, inclusion, critical thinking, creativity. They want people who have, novel and exciting approaches to the study and practice of medicine to join their community. As I mentioned before, the school has a very long-standing commitment to keeping student indebtedness low. Years ago, they launched a 500 Women in Medicine initiative, which is about leadership development for women in medicine and can, make this a very attractive option for those of us who care deeply about women's place in the practice of medicine. Research is not a strict requirement of the curriculum, but almost all students participate in research. It's a very, very large and well-known MD PhD program. And in addition to that, they have a robust, big SIB program to match first and second years to help people transition into their medical education. There are many student organizations on campus. Students are very, very involved in the life of the campus community. And this is a school where most of the clinical sites are going to center on St. Louis. So opportunities for, away rotations might be a little bit more limited. Okay. Last of the private programs is Keck School of Medicine at USC. We see here a little bit of a different pattern from WashU in that the number of interviews is very small for this program, right? Again, only 4%. However, one thing to note here is that they're interviewing 353 people and matriculating 120, which means that they're making offers of admission to a very large percentage of the people who they actually interview, which is very good information for you to have if you receive an interview. They don't have an ED program. There are MD, PhD matriculants, just not a ton. They have documented that there's one international student, but they've reported 0 interviewed. Typically, what this means is that somebody who has DACA status is being classified as an international student within the matriculated group. Sometimes you do see little kind of weirdnesses in the data, but this kind of a pattern, especially, is often what that means is that there's a student with DACA status. You can see that about a third of the class identifies as underrepresented in medicine. Average grad indebtedness is a little north of national average. And you can see that the patterns with respect to metrics, not a huge range, but a more approachable median than some of the other schools that we've seen. And the 10th to 90th percentile range is actually fairly generous for this program. So knowing that, the range is relatively broad, the medians are not as absolutely high as they possibly could be, what other things do we think that this school is looking for? Number one, service. This is a school where service begins from the first year. They are looking for people to come in with service-oriented backgrounds and show an enthusiasm for that kind of work. They emphasize that they work with a very diverse patient population, and their training sites include public and private hospitals. So folks, especially who have had experiences working in public hospitals, may be particularly attractive. There is their curriculum, they call the HEAL program. It really focuses on intersections between humanities and sciences. And so for folks who have a very interdisciplinary perspective, maybe people who have, a double major, one in the sciences, one in the humanities, or, folks who have gone through the science and public policy program and are really interested in these intersections, you could be very interesting candidates for a program like this because, they offer this specific opportunity to investigate these intersections in your career. There's also a really heavy degree of emphasis on student wellness. They look at health and define health explicitly from a lot of different angles, including mental, social, physical, spiritual, financial, academic. And so I think that, this is a place where folks who have, been part of peer mentorship programs, maybe, if you've worked with like the wellness spot at Barnard, right? That could be something that jumps out to a program like this because they're really focused on wellness and are interested in folks joining their community who who share that same interest. Okay. Um, Really quickly, next, I want to talk about a few public programs, and I include these because it is very, very important when you are thinking about applying to public schools to consider your status with respect to the school and kind of what's typical for that program. So I've done some additional numbers for these public schools so that you can see that maybe a minority of the applicants are actually in-state applicants. Even in that case, a majority of interviewees are very likely to be state residents. So for UConn, Connecticut residents make up only 10% of the applicants, but they're 66% of the interviewed candidates. Overall, UConn is interviewing about 7% of its applicants, but you definitely have a massive advantage if you are a state resident. And the vast majority of students who actually attend are state residents. There are, of course, very practical factors that can influence that, right? Meaning state public education when you are an in-state candidate is, much more affordable. So, it's very likely to see a large percentage of in-state candidates choosing their state school for the affordability purpose. And so for that reason, I think, when you're trying to assess like the friendliness of a school to out-of-state candidates, I would look at the percentage of people they're interviewing as the best proxy for that because that's less affected by these kind of other factors. There's no ED program. There are MD PhD options. International students are considered, but clearly not a huge part of the community. Average graduate indebtedness is low relative to national average. And you can see here we have yet another pattern with respect to the metrics. So medians for both of the GPA numbers are relatively high and not tiny ranges, but also not incredibly broad ranges. MCAT median is a little bit lower, and so like a little bit more approachable with a moderate range for the 25th to 75th percentile. And if you're looking, 10th to 90th, a pretty decent level of breadth considered. Oop. Things that jump out to me when I'm looking at resources about UConn. Keywords like innovation, discovery, education, and service. The curriculum changed about 10 years ago to really prioritize team-based learning exercises. And so it's a program that may be really attractive to folks who have a lot of experience in group work settings and are interested in a much more small group focused education. This is a program that also includes a longitudinal patient experience that unfolds over the course of the first 3 years of medical education. And so if you're a person who's interested maybe in a career where you are going to build those long-term relationships with patients, this kind of an option in a medical school setting can be really attractive. There are opportunities for students to serve as mentors to pre-med students, as well as a lot of student-run clinics, including a migrant farm workers clinic. And so those options may be particularly attractive to people whose long-term goals are related to service with migrant populations or interests in like mentoring in their long-term career. Rutgers, New Jersey Medical School, which is the Rutgers location in Newark. Here we can see we have a more highly populated state, so a larger percentage of the applicants are from New Jersey. And 68% of the people they're interviewing are New Jersey residents. Again, big chunk of folks are in state who actually end up matriculating. And one thing that is incredibly important to note about NJMS is that they very, very productively use their early decision program. So they also have some early assurance agreements, and there is a BA MD option, but the early decision program, which is open to any applicant who chooses to apply that way, is a really big vector for them to bring students into their class. And so this is a school where it makes sense, if this is a top choice for you, to potentially consider early decision. MD, PhD, relatively small number of international students, average graduate indebtedness a little bit lower than national average. And from the metrics, you can see a pattern like not heavily dissimilar to UConn, right? There's a level of variability here. It's not like wildly massive, but it's clear that they're not focusing on these metrics narrowly to the absolute exclusion of other things that they might be looking for, right? Their keywords, I think, are really, really telling. Things like humanistic, culturally competent, integrity, ethical, professional, compassion. They care about the character of the people who are coming to their program. They're very interested in what each person is going to contribute to their community. And so they're looking for folks who are very community minded, who are able to express their comfort with and humility in diverse settings. And they offer the oldest student-run clinic in the U.S., which I think is, an indication of how connected they are overall to their community. They offer extensive service opportunities in Newark. They are really, really embedded in the city as a very important institution, and they're looking for people to join them who are excited to be part of that broader community. NJMS also has a curriculum that really emphasizes a lot of different electives. So there's a great deal of breadth in terms of what you can pursue in terms of your clinical training, and a lot of flexibility with respect to the clinical training. And for some people, that's particularly attractive. There is also an accelerated 3-year primary care track, and that's definitely important for folks who are really interested in primary care and have a very robust kind of portfolio that expresses that interest, particularly when we're thinking about affordability, right? So looking for programs that may allow you to accelerate your education and limit your tuition can always be a smart way to move. Okay, 2 more to go. Since I did NJMS, have to represent New York State as well. SUNY Downstate is our closest institution. And here, again, we can see pretty large percentage of applicants are in-state, 38%, and 70% of the people they're interviewing are New York residents. There are some early assurance programs. SUNY Downstate doesn't have an early decision program as such. It's not a big vector for MD PhD. There is a program, but they didn't happen to admit anyone to it in 2024, and not a big kind of magnet for international students, although they are considered by SUNY Downstate. You can see that a big chunk of students at Downstate responded to the other impactful experiences question. So, it's a student body that has very diverse life experiences. And when you look at the metrics, you can see decent sized range, right? These are pretty approachable medians, for both GPAs and MCAT score. And you see there's a decent level of variability. So again, that begs the question, what are they looking for if they're not narrowly focused on the numbers? Keywords here: social institutions, competent, caring, research, strategies. Brooklyn. Brooklyn is an incredibly important part of what their institutional mission is, because as the public medical school for the downstate region, which is very heavily dominated by New York City, and as a school that is, located in Brooklyn, SUNY Downstate is very, very closely tied to its community and is really interested in students who are interested in working in that community, right? So they're typically going to be looking for folks who have service and clinical experiences with populations very similar to the one that they serve. There are a ton of options for community engagement. The medical school partners with community-based organizations, again, emphasizing its level of integration in the community, which is very important to think about. They offer a professional development curriculum, so they're really interested in, kind of helping people learn how to be professionals in addition to clinical practitioners. And they offer a number of specialized curricular pathways, which may be, interesting to people depending on your particular interests. You'll see a couple of these things like global health and social determinants of health. These are things that are, very closely aligned with like public health studies, and SUNY Downstate also does have a public health program, so there's definitely a lot of opportunity for kind of cross-pollination of ideas between those two schools. Okay, finally, moving to the West Coast, which is often a different kind of a ball game when it comes to public schools, because here on the East Coast, we tend to have smaller states. We do have more dense populations, and we often have a larger number of medical schools overall, as well as public medical schools. University of Washington is in a unique context because it's the only, so Washington is the only state in a very large region of the US that has any public medical schools. So what you see here, overall, the pattern is not massively different. The vast majority of people who are being interviewed are folks who are considered in state or in region. I'm going to talk a little bit more on the next slide about what I mean about in region. You can see, moderate sized MD PhD class, not a big vector for international students, again, related to its kind of more geographic mission. And you see a really kind of broad, very, very broad, probably the widest range of metrics that we've seen among all of these schools accepted at this program, right? So the 10th to 90th percentile is a huge range, but even the 25th to 75th, it's a big spread for MCAT scores as well as for the GPAs. So knowing that, what could this school possibly be looking for? So first of all, University of Washington is very, very clear about its special connection to not only Washington, but Wyoming, Alaska, Montana, and Idaho. None of those other four states have a medical school. And so there is a consortium agreement, the WWAMI consortium, that allows folks from the other states, Wyoming, Arkansas, Wyoming, Alaska, Montana, and Idaho, to apply with kind of preference to University of Washington. The way that they ultimately do this is like, let's say you are an Idaho resident, you apply and are accepted. You would actually start your training at a local hospital in Idaho before moving on to or a local facility in Idaho before joining like the broader medical school class. So they do that for all of the other states. The University of Washington is very conscious of the fact that it's serving a geographically very large chunk of the country, especially with the inclusion of Alaska. And it's also a region that is not super densely populated, meaning this is a program that recognizes that it is, its goal is to train people who are going to be willing to serve in rural communities, because the majority of communities in that region are relatively rural. They're very explicit that if you are not a resident of one of the regional states, it is important that you have ties to the region in order to be considered. So, this is a place where you want to think about, even if you're not technically a resident, but maybe you were born in one of these states or spent some time there growing up or have close family members, those are, possible examples. University of Washington also makes clear that while they're interested in research, they also are very, very focused on primary care to underserved populations in their region. And as part of fulfilling that mission, they offer a lot of different clinical training sites across the region, including some very distinctive rural training programs. In terms of the experience of the institution, I like to look for things like their colleges program, which is basically like small group professional and relationship development, kind of like a home base for their medical students, to be paired with upper level students and medical educators, to just kind of help people as they progress through their curriculum. And they also offer some tailored pathways to help folks who have specific educational interests. There are a number of them, I think like 8 or 9. Just a couple of examples here, right? If you're a person who's really interested in and has a lot of experience with or like has done research in queer health, um, applying for their LGBTQ health pathway could make perfect sense. Okay, so all of that said, right, the goal of doing all of these case studies is really for you to get a sense of, you know, these schools are not hugely dissimilar, right? You've heard me talk about similar words for many of these programs, but what is important for you to take away is that it is extremely crucial for you as an applicant to think about what details you can learn about these schools and how well your application is going to align. So I want to talk about just like some frequently asked questions about list building, give you some resources and things like that in order to wrap up the conversation today. So probably the most frequent thing that folks are concerned about is how GPA and entrance exam scores are going to affect where you apply. In general, my advice is that your list should include a mix of programs, ideally a lot at which your numbers are pretty close to what's typical, definitely, within range, and ideally some where your scores are relatively strong compared to the overall data for the school. Using that range data is crucial for understanding how much variability the school allows for, right? How flexibly does a school think about that number? If we're in a situation where you feel like you can make a really strong case for your candidacy based on other aspects, and maybe the metrics are in the lower end of the range, that's a very different situation from, a situation where you feel like you can make a good case and your numbers are really not close to the range. In the former case, it might make a lot of sense to add that school to your list. In the latter, it's a lot more of a risk. And the thing about focusing on these numbers that I don't like is it's reductive, right? Because GPA and exam scores can limit, sometimes options. They, however, are never the end of the story, right? They're never going to be the sole determining factor in acceptance. And their very discreteness, their very simplicity is a big part of why they are so important in the process, right? They're easy to understand. I encourage everyone to keep that in mind, right, as a kind of a modulating factor. These numbers are important because they're just easy to review. They're easy to compare. They're easy to understand. The other aspects of your candidacy are much more complicated to review and compare to other candidates. And you want to be thinking very critically about, those other aspects of your candidacy and how they're going to kind of hit the eyes of the readers. In terms of number of schools, you do have a lot of latitude, and you're applying via a centralized application service that makes it very easy to apply to any number. Average number for Barnard's cohort has been about 23 schools over the past few years, although I will note national average is a little lower than that. However, the most important thing that I think you can keep in mind is that if you're applying to medical schools in particular, you're going to have to complete secondaries. And most people run out of steam somewhere north of 20 schools. So I think that, it's rarely in a candidate's best interest to apply to more than around 25. And for some people, a lower number might be completely appropriate, especially those who are applying to like MD, PhD programs, for example. State residency. How do you figure it out? There is no easy answer here. So residency rules and kind of the process of verifying residency are going to vary from state to state. Some states, New York State, for example, are very kind of lax in terms of their approach to state residency. In New York, really, it's like literally continuously residing in the state for a period of minimally 12 months. Other states have more robust requirements around like how many years you need to have filed taxes in the state or things of that nature. I will say that generally speaking, if you are not from New York, having come to college in New York doesn't necessarily take away your state residency in your home state. In most cases, state residency is not like changed by going to college out of state, as long as your family maintains kind of the permanent home that you've lived in. Typically, maintaining your voter registration, your driver's license, things like that in another state are helpful in terms of proving residency. Other things to know are that, you might actually meet the criteria for multiple states, to qualify as a resident for multiple states. However, you can only list one state as your state of residence on your primary application. And if you are applying to public programs, you should know that they will, of course, consider the information that you provide in your primary application, but the vast majority of schools are going to ask you to do a little bit more proving of your residency status if it's important to them in terms of deciding whether to offer an interview or things like that. So, for example, if you were to apply to the University of Washington, say that you're a Washington resident, in the secondary application process, you are going to be asked to provide additional documentation to prove your residency before moving forward. Some resources that I really encourage folks to take advantage of. MSAR, my beloved, I talk to everybody about it. I just think it is a fantastic, very like easily comparable resource. It's really, really helpful for folks who are applying to MD programs. It is a subscription service, but it's not a massive investment. And if you are a person who has received approval for fee assistance through the AAMC, you get a subscription for free. If you're applying to DO programs, the Choose DO Explorer, which has similar but like a little bit less robust information about DO schools, is free. You just have to register to use it. And there is a Dental School Explorer for folks who are applying to dental programs that is, again, subscription service, but not a massive investment. And then, of course, if there's anyone out there who's thinking about other professional programs, there are guides and resources for other schools, other kinds of schools as well. So, this is what it looks like when you log into MSAR. Actually, it's updated now. I didn't update my screenshot, but you'll be able to see, the similar categories of information about the admissions process, data about accepted students, information about the educational program, costs and debt and things like that. And this can help you just kind of get familiar with a wider range of programs. I also encourage everyone to check out some of the financial aid resources through AAMC and through other educational organizations, just to start to familiarize yourself with some of the terms. You are a decent step away from the point of having to make decisions about financial aid, but the more you can learn about what's typical in terms of paying for your graduate education overall, the better. Always make sure to check out school websites. If you're using, rankings like US News, keep in mind that their rankings are based on factors that may not track with your priorities. And that some schools in recent years have, very kind of publicly said that they don't want to participate in rankings. And so the data that is provided to organizations like this might not be entirely complete. Some other stuff that I link here, and I'll share these slides with you when I share the recording. Some questions that folks could consider asking when they are, thinking about or even interviewing with programs. A little bit of, kind of a different perspective on the U.S. News rankings, and an example from the SUNY system of just like what I mean when I talk about like how you're proving your state residency. Overall, as you are building your list, as you are even considering programs before you've added them to your list, I encourage you, I implore you, take detailed notes on the schools that you're considering. Number one, you're going to need this to make decisions about your final list. Number two, this information is going to come in handy when you complete secondary applications. And I link here to a worksheet on like factors that you might want to weigh that'll allow you to kind of compare schools in different ways. keep hold of these notes that you're making as you're building your school list because, you might have questions. And if you are able to get an interview with some of the programs on your list, you can come back to those questions that you originally have, and really kind of, deepen your understanding of schools through that process, before you come to the point of making a decision. I think that this is important because, creating your school list is always a process of identifying your priorities and assessing schools relative to your priorities. When you're adding schools to the list, the fundamental question is always what aspects of your application are going to appeal to this school specifically. It is a kind of a necessary thing that applicants have to rely on online resources. Um, your assessment of programs might change if you do interview with them, or if you connect with alums who are studying at or have recently studied at programs that are of interest to you. But the bottom line is that using the resources that you have at your disposal to create a very well-tailored list is, in my opinion, one of the best ways that you can set yourself up to have a successful application cycle and ideally to have some choices at the end of the process. And that's all that I have. I know that we are a little bit over time, but happy to take any questions if folks have them. You can use the chat function, or you can, say questions out loud. And I know I've probably exhausted you all, so if you don't have any questions, that's also okay. Updated MSAR data is usually available in April, usually around the middle of April. And then, like I said, the data is not going to change massively for individual schools, year to year. Any other questions for now? Obviously, my door remains open, the door to my inbox as well as the door to my office. So do let me know as you have questions. If you, take some time, build a list, and you want to talk through it with me, you're welcome to set up time to do that, right? Like I'm happy to, kind of to bounce ideas, and to ask you questions about why you've added particular schools that might help you critically evaluate the list that you're building. I like doing that. So please do let me know as you need support as you're building your list. Oh, we do have a question. To what degree would I say a connection, not residency, to a specific state matters for medical school? So it depends on the status of the school, whether it's a private or a public school. If it's a public school and you're not a resident, you may still have a better chance if you have a strong connection to the state. So, for example, I have known Barnard grads who have, gone to school in and maybe worked for a couple of years in New York City, even if not actually New York State residents, to end up attending SUNY Downstate because Downstate recognizes a strong connection. The person has chosen to live here, has built a life here. Other state schools might have different perspectives, though, right? So you want to think about any information that the school has, relative to what's important to them. If you're seeing, an incredibly high percentage of interviews are in-state candidates, then I would say, connections like having previously lived in a state, or similar kinds of things are probably really common among the out-of-state candidates who are interviewed. And then when we're talking about public medical or private medical schools, sorry, it doesn't matter really. I mean, private medical schools, you may still see a decent percentage of people who are technically in state. For example, a lot of students at Weill Cornell here in the city are actually from New York, but it's not the majority of students. And it's also often the case that people want to apply to medical school close to where they have social networks. So I would say that you should expect residency and or connections to be significant factors in admission for public programs and not particularly significant for private schools. And while I'm talking, I have not seen any additional questions. So, um, Let me know as you have them. Thank you so much for being here and listening to me rattle through all of this. Good luck to you all as you are continuing your prep. You have, if you are applying for a committee letter this year, you've gotten the information about your interview. Have fun, and I look forward to working with you over the course of the spring and the summer. Good night, everybody.